May I request everyone to kindly rise. Thank you. Please be seated. So once again, a very good morning, ladies and gentlemen, distinguished guests, respected faculty, proud parents, and dear students. I, Dr. Yarini, Associate Professor from the Department of Microbiology, will be your host for today, taking you through the program for today. On behalf of Savita Medical College and Hospital, I welcome you all to the prestigious White Coat ceremony for the 2025-26 batch of first year MBBS students. We are gathered here to celebrate the initiation of our future doctors into the noble journey of medicine. To begin this auspicious occasion, let us invoke blessings of the Almighty. So I invite Mr. Pratap, third year MBBS part 2, to render the invocation song.
அழகான பழனிமலை ஆண்டவா, உன்னை அனுதினமும் பாட வந்தேன் வேலவா. அழகான பழனிமலை ஆண்டவா, உன்னை அனுதினமும் பாட வந்தேன் வேலவா. வள்ளிமயில் நாதனே வாவடி வேலனே, வள்ளிமயில் நாதனே வாவடி வேலனே, வரவேண்டும் மயில் மீது முருகையனே. முருகா 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 முருகா. வெள்ளை திருநீரும் வெற்றி வடிவேலும் உள்ளத்தில் தோன்றுமே, வெள்ளை திருநீரும் வெற்றி வடிவேலும் உள்ளத்தில் தோன்றுமே. வெள்ளி மயிலேறி வேலன் வரும் வரை நெஞ்சம் காணுமே, வெள்ளி மயிலேறி வேலன் வரும் வரை நெஞ்சம் காணுமே. உனையன்றி வேலில்லை தெய்வம் கந்தையா, உனையன்றி வேலில்லை தெய்வம் கந்தையா. உலகாளும் ஆண்டவனே நீதானையா, உலகாளும் ஆண்டவனே நீதானையா. முருகா நீதானையா, சண்முகா நீதானையா. அழகான பழனிமலை ஆண்டவா, உன்னை அனுதினமும் பாட வந்தேன் வேலவா. அழகான பழனிமலை ஆண்டவா, உன்னை அனுதினமும் பாட வந்தேன் வேலவா.
Thank you, Pratap. To formally commence the ceremony, it's my privilege to invite our Dean, Dr. J. Kumuda, Dean of Savita Medical College and Hospital, to deliver the welcome address. Please, ma'am. Sorry, there's a small change. To symbolize dispelling darkness and bringing in the light of knowledge, we shall now proceed with the traditional lighting of the Kuttavilakku. I request our dignitaries to kindly do the honors. I now invite our Dean Dr. Kumuda ma'am to deliver the welcome address. Please, ma'am.
Good morning to one and all. Respected Chancellor Sir, our Chief Guest Dr. Siddharth Ramji Sir, our Pro-Chancellor Sir, Vice Chancellor, Registrar and the Medical Superintendent, faculties, the proud parents and the students who are going to enter into the medical journey. Good morning to one and all. I have the pleasant job or a privilege of welcoming our Chancellor, who is a visionary leader. In fact, when we were talking in the morning, he said, we started as a small dental college and then we have now broadened our horizon and we are having such an important university of the country, Savita Institute of Medical and Technical Sciences. That is because of his everlasting enthusiasm. I have never seen him without any enthusiasm whenever we approach him. And always he gives us time. Whenever we ask him time, he is always ready. Whatever conference, seminar, workshop, or whatever, anything to do with the students, is always ready to come and help us. And always he has been a pillar of support. I have great pleasure in welcoming you, sir. Can you give the bouquet? Again, now I have the pleasant duty of welcoming our chief guest, Dr. Siddharth Ramji sir, whom I know from 1990. Because first I got exposed to him when he started a research on using room air for neonatal resuscitation way back in 1992 when I was an assistant professor at KGH. That's when he started the multicentric study. He's basically a pediatrician neonatologist, but a great academician and great researcher who's got more than 150 publications, research, both national and international, to his credit. And using room air for resuscitation was a great eye-opener as a pediatrician for all of us. And so when I invited him, requested him to be the chief guest for our function here, he readily accepted. I know he is very, very busy with his innumerous engagements. Even yesterday he was in Jaipur. Tomorrow he is going to go to Delhi. And that is how he has been very, very busy. And as a dean of Maulana Azad Medical College and the medical director, he has done a lot of innovations there. Morning only he said he not only takes a fund from the government for which is allotted to his college, also from other state colleges also to improve the patient care in his own hospital. And again, when I asked him, sir, would you have breakfast with us? He said, no, Kumuda, I have been having breakfast before 7 o'clock for the past 35 years. And I would have it at home. So there's no need to provide breakfast. That is the type of dedication he has shown all his career. And I would say you are all very lucky to have him as a chief guest, because he is going to induct you, motivate you into the world of medical journey. Once again, I have great pleasure in welcoming you, sir, and I'm really thankful that you are here. And again, I have a pleasant duty of again welcoming our Pro-Chancellor, who's the chief architect. He's not only a dentist, not only a medical person, he's a chief architect. The other day, I was going to his room, he was having a paper and drawing some line diagrams. And that line diagram of 4 lines is going to become a big hall or big auditorium. That is how he starts. So all the innovations which has happened in this medical college, take it in all the domains of medicine, either academics or clinics or research. he has been the brain behind it. And really we thank you for such a wonderful dedication and sincerity with which he is working. And he leaves only after I leave. Though I leave little late, he leaves even later than that from this campus. And I really welcome you, sir. And your words of wisdom would also help our students get motivated. Thank you, sir. I very happily, again, I welcome our Vice Chancellor, again, who has been the head of ICMR at Puducherry, vector-borne diseases, and is always bubbling with energy for research. I call him and ask him very mundane things, like even arranging a transport for somebody. Though jokingly said, he always says, that is not my portfolio, madam, but he always helps. That's a kind of person who helps in all kind of activities related to this college. I have great pleasure in welcoming you, sir. Coming to welcoming Registrar, madam, I believe I am just talking to my sister, because again, anything related to students, there will be some student who has left 10 years back and they want something out of the college. She always has the record, and she always helps in whatever we do, and whatever academic innovations we do, it goes to her, and she nicely puts it into a nice portfolio and gets it presented in the academic council and gets sanctioned, and she's always there. And again, I'm very happy to welcome you, madam, for this function. And again, welcome our medical superintendent, who is my counterpart in the hospital. And suddenly we will say, madam, sir, there is a program and you have to give the welcome address. He's all ready. Though he has been the Dean of Stanley Medical College, we work as two pieces, Dean here and Medical Superintendent there. And I'm really happy to welcome sir also. And again, I have the pleasant and heartfelt welcome to all the parents, proud parents, and the medical students who are going to embark on the journey of medicine. Of course, everybody thinks that medical field is very demanding. Yes, it is demanding, yet it is very fulfilling. See, the profound satisfaction you have as a clinician or a researcher or even a non-clinical person when you contribute to the change of a person's pain, the alleviation of pain and suffering, that goes a long way in your heart. I don't think anything else can give such fulfillment. And if you enjoy it only, when you feel it only, you will enjoy. And welcome to the world to enjoy this profound fulfillment. And as a faculty and administration, we'll be there always to back up all your problems. Be it good things, or if you have certain problems, we would be there always hand-holding you and helping you in taking this journey and make it very joyful and even colorful, because a lot of colorful things also do happen apart from academics here. And please join us in that colorful activity of this college, and we will go together into the medical world. Thank you. Thank you, Honored.
Thank you, ma'am. I now request Dr. Deepak Nallaswamy, sir, Pro-Chancellor, SMATS, to introduce Savita Medical College and Hospital and its vision. Please, sir.
So good morning to the dignitaries on the dais, off the dais, faculty members and parents and our prospective students. So we are very happy at Savita Medical College to invite the batch of 2025, and so I would like to actually walk you through, what your journey is and what is our philosophy as an institution, and to also realize, why Savita also stands tall in national and international rankings. So to start with, the thing we want you to remember is that wise minds steer towards the horizon whilst others stay anchored to the present. So the institution is steered towards the horizon of greatness. I can with great assurance tell you that definitely we will become one of the best institutions in the world, if not the country, in the next decade. So that is our vision and that is our direction, and we are very, very steadfast in that vision, and we will explain as to why and how we are going in that direction. And we also congratulate you for choosing an institution that is going to be the leader rather than just going by the present today. So if you progressively look at our NIRF rankings, we had in the last 3 to 4 years, we have been progressively increasing. So from the rank of 25 to the rank of 11. Currently, we are the 3rd best ranked institution, the 2nd best medical college in Tamil Nadu after CMC Vellore, and that is something which we are very proud of. So there are 3 domains at which we focus our innovation in. One is in academics, research and clinics, and the culmination of these 3 are the reasons why we also are able to succeed. And ultimately, you need to realize that, as an institution succeeds, it also banks on the success of the students. So tomorrow, if you say you're from Harvard, that itself carries half the weightage of what you have achieved. And ultimately, the growth of the institution is your personal growth, and your personal growth is the growth of the institution. So that is how things work. So one of the main things which was a unique factor at Savita compared to other institutions, that we were dedicated in small group learning, and till last year we were doing it with 40 students a batch. So that means we have split into 6 batches to reteach everything 6 times. That itself is a remarkable uptake, because many institutions still take classes at 250 people in a single classroom. You can only imagine the kind of attention, maybe a few students in the front may get the attention they want, but there may be a student who's not able to follow, but they may not even be able to speak up because the group is so large. They might not be comfortable doing it. But this year we are taking it one level higher, and we are taking it to we are dividing into 12 batches and bringing it to 22 to 25 students per batch. No other institution in India offers such a level of small group learning. I don't think schools even offer this level of personalized care, and that is one of our USPs. So the next factor we focus on is a factor of spaced learning or spaced relearning. So how this works is, we would cover our portions in a span of 5 to 6 months, and 4 to 5 months, and then we would again recover the portions at 2 cycles. And the reason is that if you learn and then you have some space to read about it, or space to percolate it and then again reread it, the long-term memory is much more plastically entered into the brain. Because once you read, or if the portion is taken till the end of the year, usually whatever is taken towards the end, the students do not have time to become thorough with it. So there are a lot of studies which we have also done, and we also have cited here, which shows a metacognitive awareness and also spaced education and how it helps in learning. So this is one of the primary reasons we are also able to see very good results from our students because of this kind of teaching method. So the next thing we focus on is we do concept maps, and this is to give a bird's eye view of the topic, because learning is much easier if you first learn a little bit about everything and then go in depth. Knowing everything about everything is not possible, and I don't think you need to be that ambitious, but you need to at least know the boundaries of where the knowledge expands, and for that concept maps are the best method. Almost all our teaching methods are through concept maps, and they are integrated in your exams as well. And we also have integrated modules where if we take the renal system, for example, a urologist and a nephrologist come and take the first year classes, which is also special in the sense I have not heard of many institutions where a super specialist come and take classes for the first year undergrad. So the next area is all this is translated to better results, as you can see in the graph here, and I would like to focus on R&D. So in 23-24, we were the second largest research publishing institute, publishing close to 2,500 medical publications, and of which we also had the second highest number of Q1 papers, which are the high quality papers which are in the top 25% of the journals. And we were second to AIIMS Delhi. And I'm very happy to announce that this year, that is 24-25, as you can see in the Skywell benchmarks, this is a public domain. You can see that Savita is 5,741 publications, surpassing AIIMS, which has 4,800 papers. Our citation count is also proportionally higher, and publications in Q1, we have 1,600 papers, whereas compared to AIIMS, which has 1,300 papers. You can see that, medical research itself is not a domain that's very popular. Even top ranking institutions do not have that many papers. And to create a culture of research and to bring that into our undergrad, to make a vision of the NEP to become a possibility, these are things that we have been it requires a lot of hard work and commitment. It also requires a lot of focus. And that way we are very proud of what we have achieved. And it also gives an advanced bird's eye view that definitely next year I'll be publishing with much higher numbers, with much higher output. And that's how we roll. So I've already shown the data here. So last year we had 72 top 2% scientists. We were one of the highest in the country. I think we were 6th or 7th position. And this year we surpassed that with 111, and we recently found out it's actually 112. We are second only to IISc Bengaluru, which has 118 top 2% scientists. So it also shows that the rich exposure you get here, you get a lot of very bright minds and researchers available at your disposal. And collaboration and innovation is what a university can offer to the society. The difference between a college and a university is that a college will give you training, like training to do A, B, C skills. Whereas a university is one that inculcates knowledge, it creates knowledge. And ultimately, for the growth of the society or the upfront of the humanity, you need to have the next generation people thinking about the future and creating better methods to improve healthcare or any other respective positions. So in that way, Savita is well positioned and most strongly positioned with the best amount of talent when it comes to research and output. So we also have one of the world's largest medical research summit where we publish around 4,500 posters. Most national conferences would have only 1,000 posters, give or take. All of this has to be unique. All of this is vetted. All of this is evaluated, peer evaluated. And students from all colleges come and see at all the kind of work done by our students. Next is clinical training. So integrated clinics is one of something that's very unique to Savita again. Usually in a clinical setting, it would be examination done by a doctor or the doctor explaining a case to the student. But that is more of passive learning. In this case, what we do differently is that all basic diagnosis and triage is done by the undergrad student, and they themselves develop a spirit of intuition, in the sense as you keep seeing more and more patients, you see 10 times more patients than normally you would see. And there's a common saying, a rare disease is rare, and that's because you will not be frequently doing it. And as a fresher, you would immediately start suspecting for the most rare disease when you see the patient. But with experience, as you keep seeing, you will start seeing trends, you will see patterns. These are things you cannot teach from the textbook, but only through experience-based learning. And that way, having the ability to have holistic learning and also to develop the sense of intuition, to develop clinical acumen, to make diagnosis, which will later be corroborated with the faculty. You should be able to articulate your diagnosis, defend why you think this is a diagnosis, and also suggest therapy. And that is a most real life, closely mimicking scenario to a private practice. And that is next is our MIAS system, which is a medical information archival system. It's an indigenously developed software done here at Savita by our own engineering division. And what makes MIAS unique is that most EHRs would be medical records or NABH focused. They are focused on hospital accreditation and hospital records at a clerical aspect. Whereas MIAS works in a completely different way. It's completely academically focused. It focuses primarily on the students' examination of patients and the grading of the same examination done by faculty. That is the main engine running MIAS. Whereas the other academic hospital records, all those things are there at the background. So automatically it's designed for an EPA, and an EPA is nothing but an entrustable professional activity. In medical education, you would, an EPA is one where you train the student to perform certain procedures at a distance monitoring. And only NMC is talking about bringing EPAs into medical education by the 30s or by 2035. We are already implemented EPAs across our entire curriculum, and all our graduates and postgraduates are having very clearly defined EPAs to graduate and also attain competency. And I think, see, there will always be a scenario where, you're training a group of students and 2 or 3 students really pick it up well, no matter how you teach. And then some of them are lost in translation. But when you keep systems like this, no student can graduate without the competency. That means it makes sure that every student is trained properly to see, examine, diagnose, and treat a patient. And that goes a long way, because once your subject is very strong and your acumen is very strong, there is never a reason for you to stoop to unethical practices, because you know to do it the right way. And that is one of the main reasons we focus on teaching you how to make a successful practice, but with the right tools. We also having, as Vice Chancellor was also talking to the chief guest, that we give around 5,000 to each of the patients who get admitted here, and that's why we have one of the strongest IP and OP services in the hospital, and this is continuously growing. Our ambition is to become one day like Safdarjung, which treats around 12,000 plus patients, and that would be our vision, to bring in complete excellence, because we want to bring in a system where, every student has so many patients that when they graduate, they have so much of experience. This is a photograph of our ICU. It shows how, thoughtfully designed it is, because ultimately 50% of the healing comes with the ambience and how the patient feels about themselves, and goes a long way into the psychological aspects of healing. So this is our Sprout Infertility Center. So all of these facilities, these are all for free patients. It's not the corporate division or anything. And this kind of investment or this thing most institutions would not be doing, and that is why Savita stands tall. So this is a small testimonial.
Currently in my 3rd year, our small group learning system encourages active participation. We are divided into smaller batches, allowing for more personalized attention and deeper discussions. In smaller groups, it is easier for everybody to ask their doubts and clarify them, making interactive more effective. During exams, examiners from central institutions like AIMS have praised our performance and compared their performance to our own students, praising the impact of their teaching methodologies.
I had the opportunity to come to Savita Medical College for MBBS practical exams, and I was very impressed with the quality of teaching and the examinations which were conducted in a very fair and transparent manner. The students performed well, and I would like to compliment the teaching faculty and all the members of the staff for the biochemistry department to keep up the good work.
Hello, I am Dr. Suchanda Sahu. I work as additional professor in AIMS, Bhubaneswar. This is the first time I have come as an examiner to Savita Medical College, and it was a nice experience. The campus and the discipline, the maintenance of the labs and the lecture theatres were very impressive. The students have done very well in the theory exam. and it was amazing to know that they are able to read and interpret articles, and they also have an evaluation in the theory paper.
Hello, I am Dr. Tungabhadra from PJI NER Chandigarh. And coming from a
So basically, what we have been doing in the past 3-4 years is almost all our examiners are from central institutes. So 90% of the examiners are from one of the AIMS or PJ institutions. And the reason we do that is you need to put yourself to a stronger evaluation to make sure that you really know where you stand. And mostly we have been getting very positive responses because they say that our students are able to perform equivalent to their students. And mind it that what kind of students enter AIMS, that very well. You need to be in the top 5,000 ranks nationally to get in there. So it is really happy and heartwarming to see that our students with our newer training methods we are able to uplift our students and make them have a better future. So with those few words, I welcome you all to Savitha Medical College. There is a huge and a rich journey available. You as a student, the only thing we ask of you is that use every opportunity available, be a sponge that can absorb as much as it can, because every day you come here is valuable, and you need to be very smart in making sure that you have a strong goal. You want to be successful in life, you want to be the best at whatever you do, you want to be known and respected by your peers at your society, you want to be respected by your peers in your own class. For all those things put together, you need to be very, very clever and smart in making sure that you build your portfolio from today. You attend as many programs as you can. You try to, can you just reduce the mic a little? Attend as many programs as you can. You can, it's echoing. Attend as many programs as you can. Build up a very rich portfolio. You should have plenty of certifications. Make sure that today itself you decide what kind of a central institute you want to go for post-graduation, because that is our ultimate goal. We want you to be successful and go up in life, and also ultimately become like your chief guest here, somebody who makes a huge impact in your society and brings name and fame to your family. So those few words, thank you and have a wonderful day.
Thank you, sir, for your enduring support for education and innovation. We are honored to have with us today Dr. N.M. Veerayan, founder and chancellor CIMATS. May I now respectfully invite our visionary leader, Dr. N.M. Veerayan, sir, to deliver the presidential address. Please, sir.
Good morning. Why you are all excited or what? Good morning. Very good, very good. You should be energetic like this throughout your course. Respected chief guest of the day, our Pro-Chancellor, Vice-Chancellor, Dean, Medical Superintendent, beloved faculty, and the most important heroes and heroines of the day, our students, and thankful parents for choosing Savitha. First, I would like to offer my thanks and gratitude to all for choosing Savitha for your medical education. Savitha, you all know, I need not introduce again. You know very well, and our Pro-Chancellor has dealt with all the facilities and the programs available in Savitha. Only one thing I want to add, we are very, very transparent. Your attendance, your exams, your whatnot, everything will be very, very transparent, everything will be on the online. your parents can look into your activities, and even they can follow you, where you are coming, where are you going. Everything will be monitored. Be careful. And there is no cash transaction in this campus. Nowhere cash is accepted. Everything is by app only. Therefore, your attendance, your progress, even everything is on the app. Nobody can change. In certain institutions, we hear that if you have deficiency in the attendance, you pay some amount for each percentage. 1% deficiency means you pay this much, 2 means that much, like that. Here that is not at all possible. Therefore, keep it in mind. You cannot escape. You should be very, very careful in keeping your attendance, because attendance should not be there. 100% should be there. Because if you leave one class, that will not come again. If you leave one practicals, that will not come again. You will lose it for life. Therefore, don't take or cut any of the class or lab. And use all the facilities. These facilities are created only for you. It is not for anybody else. It is for you to learn. You develop a passion that you should learn everything, attend every class, use every opportunity, use every equipment, use every experiment. And with all these things, definitely you will be the leader in your profession. Isn't it? All are blank. Don't get scared. We are very friendly with you. Don't worry that we will be very strict and all. We are very, very approachable. We are other parents to you. Whatever you have any difficulty, whether it is professional or your study or even your personal, our madam is there, vice chancellor is there, pro vice chancellor is there, even I am there. You can approach any one of us. We don't restrict anybody not to come or have a distance with you people. We are very close to you. What we want is your parents have faith in us and have left you with us. Therefore, it is our duty to see that you are grown up in a better way. We will put all our energy to see, to shape you in a good form to become a very good doctor. Not only a very good doctor, the best doctor in the society. With these few words, I wish you all once again for a prosperous and healthy life, and please use all the opportunities. Thank you very much.
Thank you, sir, for your inspiring words and unwavering support. Now I invite Dr. Kannan, sir, Vice Principal, Savita Medical College Hospital, to formally introduce our chief guest, Dr. Siddharth Ramji. Please, sir. I request Dr. N.M. Veerayan sir, founder and chancellor SIMMETS, and Dr. Deepak sir to felicitate our chief guest, Dr. Siddharth Ramji sir. Now I invite Dr. Kannan sir, Vice Principal, Savita Medical College Hospital, to invite our chief guest, Dr. Siddharth Ramji sir. Please, sir.
Good morning to one and all. I feel very happy and honored to introduce our chief guest to all of you, Dr. Siddharth Ramji. It's a big CV actually. I condensed into 4 slides. Sir is currently working in Dr. C.G. Pandit National Chair at the ICMR, and he is the editor of Indian Journal of Medical Research. Formerly, he was the Dean, Director, Professor of Pediatrics, Neonatology in MAMC, Maulana Azad Medical College in New Delhi. He was a senior advisor to the Board of Governors of MCA and NMC. He is a very good academician, clinician, as well as in research. All the 3 fields he is an expert. He has been an academic, researcher, public health expert, leader in neonatal health, who has been actively involved in the development, implementation, monitoring of public health systems for neonatal and child health in India for more than 40 years. And he has got more than 150 research publications in peer-reviewed journals, and he has edited many books, and he has contributed many chapters in many books. He is involved in many research. To name a few, he was involved in 2 large birth cohorts in India, the New Delhi birth cohort, which was established in 1969 to 72, and the other one is Garbini cohort, established in 2015, and he has been associated with the consortium of the health-oriented research in transgender societies, made up of 5 largest birth cohorts in low and middle income countries. And he has been a member of a lot of committees, technical advisory committee of the WHO, ICMR, health research, biotechnology, UGC, DST, Government of India on research, innovation and health system implementation. He was a national lead for WHO funded project for operation of district newborn care in 20 states in India, used indigenously developed equipment for newborn care under the Ministry of Health and Family Welfare. This was instrumental in the growth and transformation of the medical equipment industry in India for manufacture of neonatal care equipment. He is an expert in neonatology and pediatrics. That is the important thing. And he was a member of the expert group that formulated the India Newborn Action Plan and many other things. And he has served in WHO as a member chair of WHO guideline development groups and expert consultation in neonatal health. And he has been an advisor in Health Technology Assessment Board of India, Department of Health Research, Government of India, Chair Scientific Advisory Committee, MCH, Knowledge Integration and Translation Platform, and the Grand Challenge India Fund of the Department of Biotechnology, Government of India. He is also the Chair, Government of Madhya Pradesh, Special Newborn Care, and recipient of several honors and awards. And he has been the President of the National Neonatology Forum and has been the Executive Editor of Indian Pediatrics, the official journal of IAP, and he has been a member of working group for developing the pediatric curriculum in UG and PG curriculum adopted by MCA and NMC, and many of the pediatrician neonatologists he trained, and many of them are his students for the past 3 decades. All over the world they are spread. I am very happy to introduce sir to this audience. I welcome you, sir. Thank you.
Thank you, sir. May I now request our chief guest, Dr. Siddharth Ramji, sir, Dr. C.J. Pandit, National Chair, Indian Council of Medical Research, former Dean and Director, Maulana Azad Medical College, New Delhi, to address the gathering. Please, sir.
Well, Honorable Chancellor, Vice Chancellor, Pro-Chancellor, all the other dignitaries on the dais, faculty, parents, and most important, my young friends, the new entrants to this institution for the batch 25-26. So let me ask you, all my young friends, what is your enthusiasm level? Is it good? Yes, high, low? I need a verbal response from you people. Otherwise, our chancellor shall be very disappointed. He had to goad you to kind of respond. So are you guys enthused? Yes or no? Yes. A little louder. Yes. Okay. So I was, as they said a couple of days ago at Jaipur, talking to young students like you who had entered another medical college. So this white coat ceremony is novel. When we were students, I'm sure all of us who are physicians here would remember that we just walked into a medical college, we started anatomy, nobody ever introduced us to anything, nobody told us what were our responsibilities as a physician. We had to just learn it as we grew with our consultants and faculty. But over time, it is realized that it's very important for us to in a changing scenario, a competitive world, where for a variety of reasons, the value systems that medical care and medical professionals stood for was kindly getting depleted. It was felt necessary that it was essential for us to kind of bring back all this into focus. And this is a very big change, moving from school to a professional education. This is a big difference. When you go from school to a college, a general, it's one thing. You have to learn, but you don't have all those kind of numerous responsibilities, because the day you go in as a student, everybody around you, including your family and friends, think you're already a doctor, So you already got the label, and they look upon you differently, they expect things differently. But if you were to go to a college to do a course in sociology or anthropology or even engineering, if you walk to an engineering college, nobody thought you're an engineer from day one. But the moment you enter a medical college on day one, everybody views you as a physician. And so I think that is the big change. And so it's a huge transition, at least in India, unlike in the West, where people have a chance to transit from school to a university and then come into professional courses. And then they have a chance to look at so many other things that happen. But for us, this change is a huge jump. So you have to set aside the way you worked in schools. You have to set aside the way you were taught in schools, because once you come into medicine, all of us sitting here and your faculty are at best facilitators. You have to do the learning yourself. I can't, it's not like a school exam where the teacher tells you, okay, you write these, you will get full marks. It doesn't work that way. Here the whole world is different, you have to keep learning, right? As Dr. Deepak said, you're an institution where you're fortunate that you have a variety of disciplines. Today medicine is, you can't practice medicine in isolation. You need other departments to work with you. And so this is a great opportunity for you to utilize the resources that are available to you in this institution, which not many medical colleges have, and to be exposed to that so early, right from the first year of your entrance into the school, and the current thinking in educational technology, which is there globally, as already I can see has been incorporated into the institution's framework for teaching all of you. So there are two things you need to remember. This transition from school to the medical college bestows upon you two very important things, which is what this white coat ceremony actually kind of symbolizes and reminds you. First, that you're professionals. And professional doesn't mean that, okay, you're a doctor, an IT. Professionalism requires you to have certain qualities, right? The way you do things. For example, if you're given a time for something, for a class, you should be there on time. You can't walk in after 30 minutes, right? Something that I used to see very often, even when we were students. People who came from very far were there in an early morning class at 8 o'clock, right on time. All the hostelers will slowly get up, think, oh, I'm close by, but end up being late over there. And then because they're late, they miss breakfast in the hostel. And you can't go to work with an empty stomach. Your glucose levels in the brain will come down. So your ability to absorb and receive becomes very poor. So it's very critical that the way you dress, your output in terms of the work assignments that you're supposed to do, returning them in time in a critical way, ensuring that you understand what is required of you, respecting not only your colleagues, but the people you're going to come in contact. Medicine, remember, is man-centric, people-centric. That's the key. For you, we are all here, less for ourselves, but we're here for the people who are going to be the beneficiaries of what we are going to help them with. All people come to us with a certain trust. And for that trust to be built, you have to ensure that you deliver. And that is the key in medicine. And it's not enough to just be knowing anatomy, physiology, pathology, medicine. Dr. Deepak talked about the fact that you have good clinical exposure. There's a way where students are asked to see a patient, and there's an appraisal, goes into a system, and there is a mentor, a faculty who will evaluate and look at how close you're getting to. This is one part. This is one part that we are all familiar with. That is providing clinical care, patient care. But medicine is much more than that. I'm sure all of you at some point of time would have heard what makes a person a good doctor. You say, I'm a doctor, he's a good doctor, he's very competent. Kai rashi irukku. So there is a patient perspective which you need to, which makes you what you are, right? Which comes not only by your clinical competence, but the way you deal with human beings. If you are in government hospital like ours, which are over flooded with patients in the outpatient, in the emergency, obviously there's a mismatch between the numbers who land there and the number of people who can cater to them, because all systems have a certain capacity. It would not be uncommon for you to hear some health personnel, including physicians, shouting at patients saying, why have you come so late? Nobody comes late by choice. Why would somebody want to land up in a hospital at all? I mean, if I'm there, I would avoid a hospital. Why should I ever get to a hospital? I come because I need you. And I'm late not because of choice, my circumstances. They remember there are still large parts of this country where I still work, in Madhya Pradesh, Orissa, parts of Maharashtra, Jharkhand and Bihar, where access to healthcare is a challenge because people live in areas where there's no network. Nothing happens. It's all silent. So if you have to get to contact somebody to get a transport, you or the health professional has to walk maybe 4 or 5 kilometers before they get a signal. They don't have all weather roads. So if it's monsoon, you just wade your way through. I just did that 2 months ago when I was in the Khargone district of Madhya Pradesh. And we just had to wade through, the vehicle had to be left aside, we waded through to get to the hamlet. So you can imagine how health systems are. So people don't, so if a person comes late, he's very sick, or a woman comes in advanced labor, and let's say she loses the baby or the mother has postpartum hemorrhage, it's not by choice. We need to be empathetic, which also means that you need to have profound understanding of the socio-cultural environment in which people live and people work. So that's very important. So that means that knowledge is important. Sometimes I feel that what is missing in our medical training is all these. See, you need to be not only a physician, you need to be a sociologist. You need to be an anthropologist. You need to be an economist, you need to be a technologist, and so on and so forth. Maybe even a financial person, because all that impacts the way you work and the way you're going to help people, right? I was talking to young students like you just a couple of days ago, and I was asked to speak to them about what is my perception of what physicians' role to society is. And of course, I told them many things and used many examples, but I think to sum up, it's not enough to just be a physician and healer. You have to be a social change agent, right? You're people who have tremendous influence on society, they look upon you. People who manage and regulate health systems, people who manage, regulate other areas which impact health. And so you can be profound social change agents which can change the way life is. You also have to be very flexible to learn beyond medicine. You may have to learn a bit of engineering, you may have to learn a bit of maybe plant biology, maybe a little of veterinary medicine, it depends where you're working. But you must be flexible enough to be able to learn beyond what you have learned in the 4.5 or 5 years of medical training, and even during that period. If you have to become relevant, if you want to remain relevant to the community which you're serving. And you have to be an innovator. As an innovator, I don't mean that you go around making instruments and devices, but even innovating to find simple solutions. I have a group of friends who are people who are graduates doing post-graduation at the AIMS in Delhi from different departments. And 30 years ago, they said that, what are we doing in the city? We need to move into areas where they need us. So they decide to move into Chhattisgarh, into an area which is, as you know, Naxal infested. And they went to this village and decided they'll set up a small clinic. There are people from all specialities, the pediatric surgeon, general surgeon, pediatricians, general medicine, obstetricians, the community health people, the whole band of them. And of course, they ran a clinic. But more important, they realized that just simply running a clinic won't improve the health of people. To improve health of people, they need access to income. They need access to food. Unless you address these things, nothing will happen. So they decided actually to help them connect them with agricultural scientists who could improve the problems of agriculture and plant breeding that was having a problem. They did things which would help improve the survival of the cattle. And they found ways and means of how they could generate, the families to generate some income in their areas. So these ran parallel to their setting up a clinic. So it's only then that they really got accepted as medical practitioners. So you have to be people who have to be innovative, look at things beyond just healthcare, because what affects health has more to do by influences which are outside of health. If you don't get a water supply, what can you do? If you don't have food, what will you do? even today, in spite of all the wonderful progress that we have made in this country, of course we moved a great deal. 25 to 30% of households in this country, for at least 3 months in a year, do not have access to one meal a day. That is, India is, mind you, self-sufficient in food, okay? So it's important for us to understand these dimensions when you work with people. And if you see a malnourished person and say, give me a whole list of things he should eat, it's never going to happen. So you should need to understand the background from which he comes, what is accessible, how to put him in touch with systems that the system provides in terms of what the government does in trying to help people who don't have the resources but can still be beneficiaries. So you need that wider perspective of what's happening. And it's only then that you will find that the advice that you give will translate into improved health. And most importantly, you today have, in this competitive world, it's not just the competition among you alone, getting into through the NEET UG or PG. The biggest challenge that all of you are going to have to compete with is transformative AI. It is going to the rate at which is developing. A lot of us in medicine are going to find ourselves reduced, I won't say jobless, but reduced to doing much less than what we are doing. So you have to be creative, innovative, and move beyond. What creative AI will not do, it can't think, it can't have emotions, it can't have empathy. It could give you some solutions, but it won't perform the solution. So you should look at transformative AI as a friend, but you should use it well to move ahead. So my submission to all of you is that over the next 4.5 years, you should be utilizing all these resources, interact with your people who come in contact with you, which you'll all begin with early clinical exposure in the first year, to understand first the socio-cultural milieu from which they all come, their backgrounds, as you also continue to learn the elements of modern medicine. And not only modern medicine, remember India is a pluralistic health system. We acknowledge other systems of medicine, including Indian systems of medicine, traditional medicines. And there is huge amount of emerging evidence of the utility of all of them. In fact, in many institutions now, the research that we do is actually trying to use the principles of modern research and scientific rigor to evaluate what traditionally has been utilized to see where they work, right? So I think it's a great opportunity for you also to be engaged in, if you get an opportunity, to see what's happening. And one last bit of advice. This bothers me a great deal. The NEET PG. I find that students are more interested after the first year in preparing for the NEET PG rather than learning all these other elements that are important, skills that you need. NEET PG is okay, you have to pass. But are you going to be a great physician? I have, over the last couple of years, visited so many medical institutions. And I was rather saddened to learn that in many places at super special level, the students who came in through the NEET system have no skills. That was something I've been seeing. I remember a professor of neurosurgery at one of India's most prestigious institutions telling me that, I am spending my first 6 months teaching the student how to do a suture. He's an MS surgery, he should have known. But that is reality, that's what's happening. And I want to plead with all of you not to get into this preparation for NEET PG so early into your undergrad career. You have enough time. I can't imagine anybody who has gone through medicine and learned everything saying that you won't pass in need PG. You will. It's not the end of the world. What is more important is what will happen even if you do a PG and land up as a physician and start practicing somewhere. That is the real benchmark. Are you going to be able to perform? If you're not going to be able to perform, and as I said, transformative AI is going to take over and you're going to become redundant. So don't do that. So I think that you have a great opportunity in the institution to be able to get involved in many things. I particularly like the idea of students getting involved into research. Not that I think that you're going to do anything great, but research, the rigor of research teaches you how to look at every problem in a very systematic manner and try to find solutions. I think that is the skill. If incidentally you develop something which is of public good, well and good. If it doesn't matter. Even in everyday practice, you will always get somebody with some problem and say, okay, this is a patient I have. He has all this. What could it be? All right. I run a set of battery of tests and I find that they're not supportive. What am I going to do? So it is that inquisitive and inquiring mind which trains you in the rigors of research, tells you, okay, what else to look for? And look at it systematically. Or a patient you're treating and is not responding the way this patient should have responded. What do you do? So it is that's important. And finally, as Dr. Kumada said, and as Dr. Deepak said, medicine as a student, you should also, there is a lighter side which you need to get the stress off your, the stress of work. Medicine is always, there's an exam every week, there's evaluation every day. It becomes part of your life. After a few months, you just get used to it. It's not something that you should look at it as a monster and worry about it. Keep doing, learning, it'll keep happening. There's no problem. And as you heard, that this evaluation system is here to help you. It's not trying to find fault with you. It's not here to fail you. It's trying to make sure that you learn. If you don't learn, I'm giving you more time and giving you more opportunities, which is what the current educational paradigm that has been, which you heard about, works. There's a great talent I know amongst all of you. I heard the talent at the inauguration when I think the third year student who sang the invocation song. So in all of you, there is that talent that exists. Please continue to use it. Don't dump it, right? If you've got talent in music, utilize it with theater, arts, whatever, do it. Remember, some of the greatest scientists were all great musicians. Raja Ramanna, the physicist, was a pianist. Our former president, Abdul Kalam, used to be a veena player. So music, arts is also a great way for you to relax and allow all that you have learned to kind of settle in. There's a layering that happens. You're all familiar, I'm sure you all work with your computers, and very often things don't work well and you say, okay, I need to do a little reformatting and put them all into order. That's what the system does. Overboard, things are all over. You get a graphical picture which says where's information stored. It should be you would have seen enough of blues and reds in some synchrony, but you see some blue here, some red here, some green here. It's all dissynchronous. You can't work in dyssynchrony, right? There's always a time where all the information that you've gathered needs to be systematized and put back into an order. So taking time away from your academic work, spending some time in thinking, music, arts, whatever you love, please do that. That's very important for human development, so that at the end of the day, you don't get stressed out. We used to see a lot of this, and because of this, when I was the dean, we started a group called the Guru Cool. The guru was a cool guru. That's a modern lingo. That's what my residents and faculty told me. Sir, we get the NEET system brings people from across India, from different strata, many who are first-time college goers in their entire family. So it's challenging to land up in a medical college, right? how to ensure that they seamlessly integrate without feeling sidelined. And so the Gurukul system was created to welcome students like you. So the first 2 days were spent working with them. They would take them around, talk to them. We created a group where anonymously you could kind of talk to mentors if you have any stress problem, personal or otherwise. And they would go off every Sunday or every weekend on a cycling trip or something else just to de-stress. And then we would, as time went on during the vacations, these groups were taken to work in places in remote areas to get you an exposure to what real India is and what happens, so that you can utilize your skills, learn from them. And of course, they had some great fun. And we then invite on the 5th of September, which as you know is Teachers' Day, we invite people who have moved away from the traditional ways of working in hospital and so on, and moved away and made a change, worked in places which are difficult to work, their own experiences, and come and share with students to say what healthcare is all about. It's not just a big hospital and working here, but you need to go beyond these. So we expose them through all these mechanisms to all these things. You have many of that already built in here as a university, and you have people who are more than happy to help you. The doors are open, as you heard. So my best wishes to all of you, and I do sincerely hope that, as Dr. Deepak said, you have to be branded. Okay, you may come from Harvard, but India also needs a different brand, not only a researcher, not only a good academic, but they also need to know that people who graduate from here, the doctors here, empathize, understand the social needs of people in this country and similar regions, and how you can find solutions, right? India has great people, great brains. So if you look at what's happening globally, whether it's IT, wherever, there's one Indian behind everywhere, right? You don't have to always go out of the country to do that. When we did our research, we addressed issues that was our problem, and we found solutions locally. That's what's important. It's very difficult to import foreign ideas into the system. So use the great opportunity that you have, and I do hope that you will come out as a very different brand of medical graduates, which the country badly needs, and we can be very proud of. And I must thank the Chancellor and the university for giving me an opportunity to talk to you. It's not often that I do that now, since I'm not actively engaged in academic work, but I use every opportunity that I get to talk to young students. And as Dr. Kalam said, you're all ignited minds. You bring great ideas. So when people ask questions, I look forward to it. When people don't ask questions, I'm a little worried. That means your thinking process is not working over time. It should work over time. Ask embarrassing questions to your faculty. Ask them probing questions. Doesn't matter. They may not know it, but it will help them to go back and find an answer, right? That is, so your ability to ask these critical questions is what makes faculty respond to your needs and elevate the level of our discussions, right? So remember, as I said, you are the learner, but you're also the one who has to learn on your own. We are all here to facilitate. So if you ask me good questions, good or bad, doesn't matter. You ask me a question, my job is to give you an answer, and if I don't know, I have no embarrassment. I will go back, find an answer, get back to you. So it's mutually useful for all of us. Thank you so much, and wishing you all the best for the next 5 years.
Thank you for your wonderful insights and inspiring words, sir. So the moment we have all been waiting for is here. So the white coat ceremony will now begin. I request the students to come onto the dais from one side, receive your white coats, don it, and go back to your seats and be seated. I hope that's clear. I request our esteemed dignitaries on dais to begin the presentation of white coats to the students. I now invite the heads of the department, anatomy, physiology, biochemistry, and community medicine to call out the students' names in order.
Good morning, everyone. Good morning, my dear students. Myself, Dr. Karthikeyan, Head of the Department Anatomy. Over the last couple of years, you have shown consistent hard work, dedication, and perseverance. Because of all combined efforts of you, your parents, and your family member, your MBBS seats are all confirmed in the one of the well-reputed and top-ranked medical college in India. First of all, hearty congratulations, all of you. Every doctor has two dreams that are the most beautiful in their budding stage. One is wearing the white coat, another is wearing the stethoscope. We, Savitha Medical College, are extremely proud to present the white coats to the distinguished students who gathered here. We feel this is a well-deserved reward for your dedication and commitment, so you can receive it proudly with a smile. To begin, let me start from first name of this batch, Yakshida Nityanand. Yes. SV Roshan. Just a minute. Sir, PowerPoint முன்னாடி போயிடுங்க போட்டோக்கு. SV Roshan. Harita SR. Ishana Agarwal. Rishi Keshav. Sai Kriba. Dia S. Krisha Pandian. Aisha Nashita. Meghnas Tara. Harini Muthu Manigandan. Harshini Kamalakannan. Ifra. Yesnara Parveen. Sriram V. You can clap. Mithules KG, Nitesh JS, Arjun Govind, Badri Prasad R, Mohammad Hamdan, Shirlin Jovita Javier Raj, Guru Adityan J, Saisa Gopalan, Safia Harun S, Jivita S, Rukshana Shahina Rahmatullah, Hema Roshini D, Nitin Balaji AN, Shurya Dev T, Tarun Siddharth K, Ashokamitran N, Shikam Shurya Satya Dhritti, Akshita RV, Sahana AN, Sanjay KS, Harini V, Raisel Raina J, Gauri Sajit, Danis Kumar M, Shivani A, Kalyani Anand, Vishal B, Pavitra K, Aliza Saghil, Nayantara M, Kiran Sena Christo, Harsini E, Danista Sankar, Harika N, Krishna Kumari, Maunis Reena Loganathan, Harini Sudarsan, Muhammad Saruk Munir Saiful Ahmad Sharif, Bala Pritika, Hari Shankari S, Neharika Gobi, Kaushika S, Sangamitra VA, Shakti Mantra S, Anis Fatima B,
Tejashree S, Devaki Priyadarshini GB, TM Rakshita, Rakshita, Vattaraju Samhita Sri Krishna Pranaya, Chilakala Harshavardhan, Niyati Kotari, C. Latiba, Roshni S. Irfan M. Sania Ullas, Jashwant EP, Mahashri, Diksha Prabhakaran, Kaushik, Rajashri Arulnidhi,
I request our chief guest, Dr. Siddharth Ramji sir, to hand over the white coats to the student.
Harshat K. Shivani GP, Nitin R. Sonal R. Bhavya V. Sahiti, Evelyn Bernice Kishore Lal, Dev Mitra V, Pavitra A, Evangeline Karunya Kishore Kumar Gunavati, Naina, Harshini Jayashakti, Purvika, Mohammad Najib, Harish, Mohammad Ridwan, Prem L, Logesh Shanmugam, Fardeen Khan, Vivek Anand, Ashika, Prashita, Abhi Dharanidharan, Vikasini, Shriram, Surya K, Abhishek Arun Prasad, Jeeva Sudarshan, Harshavardhan, L. Bhavna, Anand Siva, Anna Syed, Madhavan M, Sri Harini, Rupa Sri Mahesh, Nishant Guru, Jeffrey Nirmal Jo, Roshni S, Rahul D, Vishnu Vardhani, Anusha Neha, Saswat Pranav, Amruta Dayal, Ganesh Kishore, Sri Ashwin Muthukumaran, Aniruddha, Hari Prasad,
Hubli Ramana. Andrew Clement Kingsley. Jacqueline Jorisha. Abdur Rahman. Yes, Vijay Surya. Joshita Kadiravan. Mohinder Krishnan. Kartigeyan. V.S. Niveta. Midun Gangadhar. Subesh. Hemashri. Sibiraj. Archana. Nirmal Raja. Vajiha Bano. Gokulanandan. Harish. Sri Kirti. Lakshmi Shyam Nair. Netra. Srivatsan. Karunya. Ajay Krishna. Fahad Fala. Jacqueline. Tanuja. Prakita. Gayatri. Vidi. Tarukeswaran. Danya. Kritik Nithilan, Preeti, Danesh Durai, Rupan Uma Narayanan, Ashweta, Kalyani, Abhirami, Asmita,
Thank you, Dr. Siddharth Ramji, sir. I now request our Vice Chancellor, Dr. Ashwani Kumar, sir, to distribute the white coats to the students.
Yashini Aishwarya, Meda, Niranjan, Netra, Gaudami, Jinal Bohra, Roshini Chakravarti, Tamilarasu, Akilan, Kavya, Dakshina Sri, Devadarshini, Lingesh Pattabi, Rakshini, Sudarshan, Jennifer. Thank you.
Lakshana Rajesh, Kirtana, Tarika S, Kalaimani Pandian Tarun, Darshini Priya, Sarvesh S, Madhava R, Lasya Padmaraju, yes, Harihara Sudan, Safa Parvin,
Thank you, Dr. Ashwani Kumar sir. I now request Dr. Sheeja Varghese ma'am, Registrar, to distribute the white coats to the students.
Nuha R, Tanushri R, Adit Mittal, Shrija Manchanda, Gibran M, Mia Gupta, Bandaru Akshaya, Puvada Nisha, Diksha Sri, Panjagalla Reddy Hemant, Cynthia Daphne Y, J, Dreya Shah, Mudaliar Alosia David Raj, Tirtha Krishna, Adire AG, Dia Anif, CJ Manya Reddy, Kirtana Velmurugan, Gayanita Shri, Zeni Raha Z, Logamitra, Tarun GI, Yeveshian, Aniruddha Patel, Rahul KR, Mokshim Saket, Suhita Reddy, Sanyukta Rajan, R. Chandrika, R. Kashvi Saisri, Love Bharat Dubaria, Jeevanavi J, Jarnisha J, V. Ramachandran, Pavitra S, Sriram N, Mrudula Kannan, M. Pavitra, Abhinaya MS, Charan Dev S, D. Kishore Ramalingam, Kanagashri SP, Aditya Kumar, Vijayavarshini PS, Priyadarshini D. Thank you.
Thank you, dignitaries. And congratulations to all the students. May your white coats always symbolize empathy and excellence. May I now invite Dr. Ashwani Kumar Sir, Vice Chancellor SIMATS, to bless and enlighten our newest cohort of medical students. Please, sir.
I think it is already very late, and I would first give my regards to our dignitaries on the dais and our faculty members of the dais, parents of all the students, and I would say only three things. Number one is that you have taken a wise decision after listening to the achievements and accomplishments of this university. We are very forward-looking universities. We want to be ahead of the curve in many things, innovation, research, while we also focus very deeply on academics and our clinical services. And as you will be exposed very soon to all these facets of our university, you will realize that your decision and your parents' decision has been very good. The second thing which I want to tell you is that there are, I believe in 3 H's. H. One is anything you do, whether studies or your relationships or with your parents or with your peers, should be based on honesty. Honesty brings honor and happiness to you. Once you are happy, physically and mentally, you are healthy. So a doctor must be in good health and good shape to provide health to others. So this is very, very basic about the human nature. The third thing is that, which I want to tell, I want to be very brief today, is that a formula of 5 and 50. If you spend these 5 years productively and with all your hard work and whatever, a great IQ that you have, put to use the rest of the 50 years or 60 years or 70 years that you live, you will be very, very comfortable. You will enjoy those 50, 60 years. So invest into present and reap throughout your life. And your parents, everybody, your relations, everybody will be very proud of you. Of course, we want you to excel. And if you enter our medical college, it is written over there, excel to serve. Not, it's serve to excel, I think. So you have to really have this ingrained in your mind that you have to really excel in whatever you do. Okay, there should be touch of finesse and class in what you do, and then only you will be way ahead of all your others, because competition is very, very intense. And here we will give you opportunity, mold you into medical researchers by the time you are MD or even MBBS. So this is the only university in India which exposes you to undergraduate research, which is our forte. It's very strong. And you will be very proud in hanging the posters next year, and you will be defending. This year, when we had Star Summit, the first year student was defending her work, and the chief guest, who was from Tata Memorial, director, he said, I thought that I was talking to a postdoc rather than a first year student. And that is the kind of molding that happens here, provided you are for it. So make best of these opportunities. Congratulations to you. Congratulations to your parents. Thank you very much for choosing Savita. You are most welcome. We are always available to help you. Thank you.
Thank you, sir, for your wonderful insights. Now I request Dr. Shrija Verghese, ma'am, Registrar CMATS, to speak a few words.
A very good morning, respected dignitaries on the dais, my dear students, faculty, and proud parents. Today, I think it is your dream has come true. Seeing you in this white coat, not only you, your parents, everybody's dream has come true. And at this happy moment, I want to tell you that till yesterday, all of you were studying for yourself. It is, the purpose was to get admission or to get marks. From today, that is after wearing the white coat, now whatever you are studying is for the patients whom you are going to treat later. So that gives you a responsibility. So you can't afford to not to study. It is a responsible decision you have made to come into this noble profession where everybody treat doctor next to God. So you can't afford to not to study. So that responsibility throughout your career, you need to show that. Next thing I want to say that I don't want to scare you, but I want to tell the lighter side of it also, because being admitted in this university, which is a multidisciplinary university, you have, as our chief guest said, that you have a lot of other talents also. You can make use of it. We have courses, you can do part-time courses for Bharatanatyam, Carnatic music, or even architecture, some diploma if you want to do anything, or even computer science if you want to do any courses. We offer all those courses, whichever, if in addition to this, you can do many of these courses as well. And to the parents, I want to tell you that we have a very good mentoring system, and this university, every student is mentored by a mentor, and the mentor will send you a report weekly basis, that is called as Guru Padigam. That is, every week the mentor gives you the report of your child, whatever happened in the college, not only his marks, attendance, and whatever his achievements or his, while mentoring, what was his that week ambition or whatever he wanted to do, and how much he has achieved it. And moreover, he will also, that Guru Padigam also contain whatever activities has happened in the college, including your other students or your awards, achievements, everything will be there in the Guru Padigam report. And the mentor, the parents, don't think that once they got into admission in the medical college, everything is over. You don't have to, till 12th you were the one, you are teaching them every day, you were sitting with them and teaching them. That type of involvement may not be required, but that doesn't mean that you don't have to ask the mentor anything about that. You can ask the mentor every week how the child is doing, and that will help both you as well as the child to know about the whatever happening and improve the child's performance. And as everybody said, the university is providing everything, good infrastructure, good clinical training, good academic training, and the facilities, everything is available, and make use of it. And best wishes, and once again I welcome all of you to our Savitha family.
Thank you, ma'am. I now call upon Dr. Ponnambala Namasivayam sir, Medical Superintendent, Savitha Medical College Hospital, to administer the white coat pledge to the first year MBBS students.
It's time for white coat ceremony oath. All the first year MBBS students, please stand up. Put your right hand up, out, and to the front, and repeat the oath I say now. During the period of study, I shall live a disciplined life with my teachers and peers. My action shall be guarded, service-oriented, and free from indiscipline and envy. In my dealings, I shall be patient, obedient, humble, constantly contemplative, and calm. I shall aim my full efforts and ability towards the desired goal of my profession. As a physician, I shall always use my knowledge for welfare of mankind. I shall always be ready to serve patients, even if I am extremely busy and tired. I shall not harm any patient for the sake of monetary or selfish gains, nor shall I entertain a desire for lust, greed, or wealth. Immorality shall not emerge, even in my thoughts. My dressing shall be decent, yet impressive, and inspiring confidence. My conduct shall always be appropriate, pleasant, truthful, beneficial, and polite. I shall use my experience in actions appropriate for that time and place. I shall constantly endeavor to accomplish, keep updated with the latest developments in the field and widen my knowledge. I shall treat patient of gender other than mine in the presence of relatives or attendants. When examining a patient, my discretion, attention, and senses shall be concentrated on the cure of the disease. I shall not divulge the confidentiality related to the patient or family inappropriately. Although an authority in my subject, I shall not display my knowledge and skill with arrogance. Thank you very much.
Thank you, sir. Now we move to an inspiring segment where two of our students will share their journey and experiences at CIMATS. I invite Ms. Deepika, final year MBBS student, and Mr. Guhan, second year MBBS student, to share their wonderful experiences they have had at CIMATS.
Good morning to one and all present here. I am Deepika from final year MBBS, and I'm here to share my experience in Savita Medical College. A journey of 1,000 miles begins with a single step. This takes me back to the 16th of March 2022 when I entered Savita Medical College for the first time for my own white coat ceremony. My heart was filled with dreams and aspirations, but at the same time, there was some sense of uncertainty about the future, but I was hopeful of getting through all that this journey had to offer. Alma Mater is not just a place of academic education, but a place where a student discovers his or her hidden talents, learns about teamwork, decision-making, and problem-solving. This leads to the development of one's personality, and that is the reason why we feel so emotionally connected with our school or college. I was a student of SBOA school in Ananagar, where the child in me was taught to open her wings and soar high. All my teachers guided me at each and every step, be it academics or participating in debates, elocutions, or quiz competitions. Here in Savita, I found myself to be in a similar environment, if not a better place to score, perform, and push my limits beyond what I had ever done in school. My very first impression about this college was the infrastructure and amenities which contributed to enhance my overall learning experience. Now, talking about the unique teaching style of Savita, our college is the only one in the country that focuses on small group learning and student-teacher interaction. All of us were divided into groups of 40, and our classes were always interesting with fun quiz sessions, demonstrations, and role plays. This not just helped us to study better, but also to bond with each other and make friends. None of us ever felt left out or bored about having to attend the long lecture sessions. To be very honest, my first few weeks in Savita were quite difficult because I was exposed to anatomy, physiology, and biochemistry for the first time. These subjects are taught in first year and form the basis of the entire medical curriculum. So looking at the amount of information that I had to digest and the thick books that I was supposed to read, I was on the verge of giving up. This was the time when I came across the concept map style of studying. Concept maps are very much like your first handwritten notes, which make use of flowcharts, diagrams, and mind maps. So this helps you to break down the complex concepts into simple sentences for better understanding and retention. So we had an assessment at the end of every week. So this was the time when I was introduced to the concept of fast learning with spaced repetition. Now what this means is, I try to cover as much portions as possible during the beginning of the week, and I also get to evaluate myself by writing a test at the end of the week. We also had multiple revision classes along with this, which helped me with my memory. In this era of artificial intelligence, human memory is equally important, especially for us doctors. And if given the proper guidance, I do personally believe that the human mind is capable of reaching greater potential. And this is exactly what I got out of my college. All my professors not just helped me with my subject, but also helped me master the technique of how to approach them. Slowly, as the days went by, I realized that I had unknowingly enrolled myself in a college which was one of its kind, not just in terms of teaching, but also in giving proper guidance to its students. As I look back, I have no regrets, and my dear juniors, I am confident that your decision of joining MBBS in Savita would be one of the biggest turning points in your medical career. This was also the time when I was exposed to the MedStar Summit. MedStar Summit is an annual conference where students are expected to present their research projects in the form of posters. Initially, I was quite apprehensive because none of us had ever heard of a college that promotes research among the undergraduate students. I mean, is it really possible? With such doubts in my mind, I approached my research mentor who helped me develop confidence, and I ended up getting awards for the best poster presentation. I would like to thank our Pro-Chancellor, Dr. Deepak Nallaswamy sir, because the MedStar Summit is his brainchild. Sir always inspires us to aim for the stars and to come up with new ideas and think out of the box. So a student who knows how to answer questions is always rewarded with answers, and developing the habit of research right from the beginning would go a long way in helping us in our future endeavors. I'm very happy to share with you all that after my experience with MedStar Summit, I published my very first paper in Elsevier Journal the following year. So not just about research, Savita also gives equal importance to early clinical exposure. Textbooks can teach you about the science of medicine, but it is the patients who teach you about the art of medicine. So an integrated clinic is a place where doctors from various departments are available at the same place. So you get to see medicine, surgery, dermatology, psychiatry cases all in one place. It was a heartwarming experience to interact with the patients, talk to them, and be of support to them. This taught me the importance of building a rapport with the patients for a healthy doctor-patient relationship, because treatment for any ailment first begins with the building of trust and cooperation between the treating clinician and the patient. Savita has never stepped back from recognizing the smallest to the biggest contributions of its students. We were all awarded with medals and certificates for our academics and extracurricular activities, and the top performing students were given scholarships as part of the MedSignia and Founders Day celebrations. This kept the fire of learning burning within us and motivated us to become a better version of ourselves. So memories keep flowing, but I'm running out of words. Savita Medical College has not just inducted me into the field of medicine, but has taught me to be brave and courageous while facing the competitive world. As I look around, I see my professors who are working all day while giving lessons on multitasking. I look at my peers who are dealing with exam pressure and who never give up. I look at the nursing staff who take upon the workload and yet never complain. I look at the college administration for lessons on leadership and management. Again, as I look at Savita Medical College, I'm reminded of that mother who has nurtured me inside out and who continues to do so even now. I wish you all the very best for your future endeavors. Thank you.
Good morning, ladies and gentlemen, and very warm welcome to everyone present here. I am Guhan Madhu, second year medical student, and it is my honor, my pleasure to welcome all of you here today. You just heard the experience of one of our senior students, and now I'll tell you my experience as somebody who has just completed their first year at Savita. And this might sound cliche, but it was just 12 months ago when I was sitting right here where you are currently as roll number 001 of my batch in the very first row, in the very first bench, and I was such a mix of emotions. Half of me was optimistic and excited, but the other half of me was a lot more nervous and anxious, and I had so many fears. What if I come to college and I couldn't pass my exams? What if I fail academically? What if I couldn't make friends? What if nobody liked me? So many worries were coursing through my mind, and I'm sure many of you here today might even have similar worries. But let me tell you, just as I did in my first year, I am certain that all of you will manage and grow to conquer all of your fears, to rise above them, and to emerge at the end of 12 months as much more mature and much more confident individuals. Now, in my personal experience, if I had to describe Savita's culture in just 3 words, the words I would use are innovation, ambition, and determination. Because I quickly realized here at Savita that we always do things in a very distinct and unique way. And initially, I was quite skeptical. I thought to myself, why can't we just do things the way everyone else does them? And then I realized why. Because at Savita, we don't just blindly follow the norm. We innovate, we push forward, and we always do our very best effort. If I had to list some of my favorite moments of Savita throughout the year, I would say very first of all, on our very first day of college, we were given official concept map collections by our college. And this helped me so much by telling me the most important topics, subtopics, chapters, and it gave me a basic understanding and a grasp of the fundamentals of every subject even before I touch the textbooks, which can be a lot more complex to understand in medicine. Secondly, because we have a much smaller teaching system, in Savita, I've always felt like every single one of my faculty genuinely cared about me and my progress as a student, and they know me on a personal and intuitive level. We were also assigned to our academic mentors at the beginning of our year, and my academic mentor helped me so much in terms of understanding how to study, where to study, what resources, materials, and textbooks to use while studying, because medicine has dozens of textbooks, and how to approach examinations. And this helped me so much elevate my game as a student throughout the year. Now, thirdly, something I'm very proud to say is unique to Savita is that even in our very first year, we get genuine medical exposure in the hospitals and clinics. As a first year student last year, I was able to actually go to the hospital and apply my own theoretical knowledge. I was able to interact with patients. I was able to look at their biomedical signs, their CT scans, their x-rays, their vitals, and even perform certain physiological examinations on these patients, which gives me so much more exposure as a doctor in the field. Fourthly, at Savita, we also have a strong culture of research, as you just heard. We are assigned to research mentors at the beginning of our year, and my mentor helped me so much in developing my project and eventually explaining my project in the form of posters at our very own MedStar Summit. I managed to win first place in all 3 of my posters at the summit, and that has given me so much more confidence and comfort in doing research in the future as well. Fifthly, perhaps my favorite experience at Savita as a student is that even in our very first year, we got numerous opportunities to go to countries across the world as foreign exchange students. We went to top universities in countries across Asia and Europe, and it not only gave us so much exposure and education, but it was of course also very fun and very enjoyable of an experience. Last but not the least, I was also very pleasantly surprised when I came here and realized that we had so many clubs and communities for so many varied extracurriculars. We have large and active communities for things like sports, arts, debates, MUNs, music, drama, theatre, and we even have our very own Rotaract Club of Savita, of which I am a proud member of in my first year. And we are associated with the official Rotary Club of Guindy in Chennai. We frequently conduct important programs and events in nearby villages and towns. In fact, just last week, we conducted events on raising awareness about important topics like menstrual health and domestic violence, and we gave free healthcare to all the villagers, because it just feels so much better to give back to our community and give back to our neighbors. Now, I'm not going to mince my words. As those of us who have chosen a career in medicine, it is going to be a long and difficult ride. That is the nature of medicine as a subject. And there have been many times throughout my first year where I have felt like I have so much work to do, where I'm being pushed out of my comfort zone, but ultimately I will tell you, diamonds are forged under pressure, and at Savita, we are crafted into perhaps the sharpest diamonds of them all. I can tell you that 5.5 years from now, you'll look back on this very day, October 6th, 2025, as your first step into a brand new journey as being a medical student. And you will emerge as not just great individuals, but more importantly, as great doctors. Doctors with a sense of obligation to their patients, doctors with a sense of dedication to their subject materials, and doctors with a sense of ethics, morality, humility, and honor. For as medical professionals, we are servants to the people, and I am very certain that all of you in the future will save so many lives, will bring happiness to so many families, and make the world a better place. And I am certain that we will be proud to call all of you students of Savita. I wish you all the absolute best of luck for your journey ahead. Thank you.
Thank you, Deepika and Guhan. To conclude this special event, I now invite Dr. Alagar Raja sir, Deputy Medical Superintendent, Savitha Medical College and Hospital, to propose the vote of thanks.
Good morning. It gives me immense pleasure to deliver the vote of thanks for the white coat ceremony for MBBS batch 2025. At the outset, I thank our guiding light, our beloved Chancellor, for gracing the occasion and delivering an inspiring speech to the students. I thank our dynamic director, Dr. Deepak Nallaswamy, a beacon of academic excellence and innovation, for introducing the institution and sharing his thoughts to the students. I thank our esteemed chief guest, Dr. Siddharth Ramji, Dr. G.C. Pant, National Chair ICMR, former Dean MAMC New Delhi, for accepting our invitation and delivering a wonderful speech to the student. I thank our Vice Chancellor for his presence and words of wisdom. I thank our Registrar Madam for her address to the students. I thank our Dean for her welcome speech and her thoughts to the students. I thank our Medical Superintendent, Dr. Ponnamalam Namasivayam, for taking the vote for the medical graduates. I thank our Vice Principal, Dr. Kandan, for the introductory speech, and I thank all the HODs, faculties, and staffs for their presence. I thank the MC team and the student volunteers for their wonderful cooperation and arrangements. I thank the technical staff for the cooperation. Finally, I thank all the parents who have put their hard work for their children's career, and I'm confident that they have chosen the right place. Finally, I congratulate all the students that they will have a wonderful stay in Simons and wish them a great future. Thank you.
I request all the medical students to sit down and request all the others to give a standing ovation to the medical students who are entering this. Thank you.
Thank you. As we conclude, I request everyone to rise for the national anthem.
मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Please be seated. I have an announcement to make. I request all the students and parents to proceed to the Medical College Hospital building, second floor. Your books are being distributed at the Solai Hall, second floor, Medical College building, hospital building. And for the parents, food is being served at the Munch Market. You will find it right opposite Solai Hall. Thank you once again. Have a great day.